Hello, board-certified dermatologist Dr. David Bushore here at Balcones Dermatology and Aesthetics. So today we're going to be treating Kayla's nose, and this was brought up by her. I don't bring these things up to patients. I let them make the suggestions of things they want to treat. But what we're wanting to do is provide some support. She wants to help bring the tip up a little bit. And so what we'll do is we're going to provide some support underneath the base of the nose first, and then we can treat up in here and actually create a tip that's kind of above where her normal tip of her nose is. And it'll give the illusion of a lifted tip to her nose. So here we go. So now I'm going to clean first, make sure we're really good and clean. Go ahead and tilt your head back for me there. Good. Clean, 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 clean. Good, and then we're going to be using Voluma, and you do want to go to the base of the nose. It's actually one of those that you can feel when you get down to the bone that's down here. This does sting a little bit, so. Right down here. Good. You okay there?
Yes, sir.
Okay. So we're injecting Voluma, and we're trying to provide support underneath the base of the nose. This kind of helps lift it up. And we inject really slow just because we're watching for anything important. The nose is a very vascular structure, and there's a lot of important blood vessels around there, and that's why you want to make sure you're at the base of the nose and you're touching bone. So that's why it's very important. So there's a bone at the base of the nose, and then it comes up, and then it's called the columella. It's the cartilage that kind of goes up from the base of the nose towards the tip of the nose. But we're just doing this first, and just keep a close eye on this. And this will actually help fix what's called the nasolabial angle, so the angle between the nose and the upper lip. That's it on that. Oh good, no bleeding. But you can already see how that's provided some support underneath her nose, and it looks a little more straight and helps fix that angle a little bit. Kayla's having some allergies today, so if you notice her sniffling and things, it's not from these injections. So now we're going to just create a little bit of a tip for her here and try and move it back, just right back in here. So there's lots of blood vessels in the nose, and this is important for understanding anatomy, so you know where the safe places to inject, safer. So there's a pair of dorsal nasal arteries that come down on either side of the tip of either side of the dorsum of the nose like this, and they come down. And they actually connect with the lateral nasal arteries that come up here right above the super tip. So there's the tip and then the super tip. They connect right here and make a little arcade right here. Arcade or like a loop, and so that's where they connect. So you want to kind of, they always say if you're doing injections, you want to stay midline as much as possible if you're on the dorsum. When you come in here, all these arteries are actually deep. So we want to stay superficial when we come in here for the tip of the nose, and that's just a safer place to inject for doing nose filler in this location. So this stings a little bit too.
Okay.
So we want to stay right in between the cartilage right here in the middle. And we come down here and then we'll inject here. Yeah, it stings a little bit. And then we're right in midline here. Stay superficial. Start our injection. Again, we go really slow. Good. Got about 0.1 in so far, and then we'll just take a look at this and make sure that we're good. That looks great. So this is referred to as a liquid rhinoplasty. So you use filler to kind of help correct some, to help change the shape of the nose without surgery. So. Gosh, I think I may stay with just this. I'm gonna check it from both sides and make sure I like it. You see, turn towards me a little bit. Yeah, I'm just gonna do a little bit more to this side here. Good. Check it from The tip of the nose actually is supposed to have 2 little light reflexes on either side. And so, you know, I put a little bit in the tip, and so we filled that first, but I wanted it to be more rounded, I guess rounded, or more just to have a more typical end of the nose shape. If you have a little bit of light reflex, like the little bumps on either side there, it looks more natural instead of being like just one point at the end. So you can see a difference.
Yes, for sure.
It's subtle. I didn't change it too much, but we got the support underneath here, and so it kind of lifted that up. And then we added a little bit just here to the tip of the nose, recreate the tip of the nose. Just a little bit here in the middle, and then, you know, a little bit on either side, just to kind of give it that rounded appearance. But this, people say you may have to repeat this every 1 to 2 years, but it is one of those that it does seem to last for a pretty long time, because it's not in a place that muscles move a lot. So even though we just used Restylane, which does have like a 1-year half-life, 1-year expiration date, I guess, it does seem to wear off in a year, but this should last a good long time. And it just kind of rounded the tip of her nose and just elevated it a little bit. I think it looks very normal and natural. I think it is different, but I don't think too different. She still looks like Kayla, so. Yeah, and it's interesting, you can notice like when she smiles now that her nose doesn't come down as much. I mean, partly is because I put that filler underneath there, that support underneath, but also there's lidocaine in that, and so that kind of numbs that little muscle that pulls down when you smile. So you can watch when, yeah, so just relax and then smile. You can see her nose doesn't drop down anymore like it used to when she would smile. So, looks great. Yay.